Okay, last female structure is the vagina. Make sure that you can find the vagina on a mid-sagittal section. I'm talking to you women. A lot of times women cannot find this on a mid-sagittal section, so let's make sure that you can. It is, of course, inferior and continuous with the uterus, right? It is anterior to the rectum, and it is posterior to the bladder and the urethra. So, 3 openings in the female: external urethral orifice, vaginal orifice, and anus. Okay, if you're looking at a mid-sagittal section. Also, of course, make sure that you can find it from this view, right? So you can't see the vagina, but that you can see the vaginal orifice, external urethral orifice or urethral opening, the vagina, and the anus. Make sure you can find it from all of those locations. Okay, now let's talk about functions of the vagina. It is, of course, if an ovum or oocyte is not fertilized, it's going to be expelled through the vagina because it would have moved from the ovaries through the oviducts into the uterus, past the cervix, and then expelled through the vagina. It is, of course, the birth canal for a vaginal delivery from here. Okay, and of course, during typical vaginal intercourse, it's going to receive the penis and the semen during typical vaginal intercourse. And let's start looking at the parts of the vagina. So if you look at this portion right here, so here's the vagina. This portion right around the cervix is called the fornix of the vagina, surrounds the cervix. And then the vagina, you can see the rugae or folds in the vagina. I'll show you what it looks like. This is a photo that's showing you, these are the folds or rugae in the vagina. Here's the cervix, right? And this region right here around it, of course, in this picture, there's not much around it because it's compressed, but this would be the actual fornix. Okay, so let's look at the tissues that make up the vagina. The outer layer of the vagina is just basically connective tissue, because if you look back at this figure for a second, you can see that as the vagina runs through, there's connective tissue all the way around it. So, and then the middle layer of the vagina is going to be made of smooth muscle in the wall, okay? And that's called the Muscularis layer. And then the inner layer of the vagina is made of this mucous membrane. It's got deep folds in it called rugae, of course, and the rugae are actually important for 2 reasons. They stimulate the penis to make ejaculation more likely, and then of course they allow for a tremendous expansion during childbirth. And this tissue that is lining the lumen of the vagina is moist stratified squamous epithelium. It actually has special secretory capacity. It secretes glycogen, which is a sugar compound, and glycogen, when it hits the vaginal lumen, is fermented to keep the vagina slightly acidic. And the acidity of the vagina is good because it's hostile to most pathogens. In addition, it can be hostile to some sperm and semen, especially if like 2 mammals are closely related. A lot of times there's a negative response to the 2 of them. And the opening is, like, as I mentioned, called the vaginal orifice. And not shown in your textbook for reasons I don't understand, probably because it's not anatomically super significant in most situations, but culturally it has been really significant. To greater and lesser degrees before the vaginal orifice has been opened or penetrated or damaged in some way, shape, or form, there is, to greater and lesser degrees, a tissue covering called the hymen that is covering the opening to the vagina. It's a vascular membrane that covers the vaginal orifice, but there's tremendous variation in hymens. So this is this vaginal covering. This is what it looks like, sort of a typical hymen. There's sometimes a less of a hymen. Sometimes there's almost a completely imperforate hymen. This imperforate hymen This woman would probably have a relatively long menstrual period because it's not like it's completely imperforate, but it has microscopic holes, and maybe she would menstruate for like 3 weeks out of her cycle instead of, a few days to a week out of her cycle. So how can you rupture this? Of course you can rupture this with vaginal intercourse. Absolutely. You could also rupture this with masturbation. You could rupture this with insertion of a tampon. You could rupture this with a normal pelvic exam. You could also rupture this with sporting activity. You could rupture this with a fall. Nothing actually has to go in there. You would just have to, if the tissue was really, really slight, it could be ruptured by almost anything. Now, in this situation with the imperforate hymen, sometimes this actually has to be ruptured surgically before a woman can have vaginal intercourse. And you would not necessarily know this unless you knew something about female anatomy and about yours specifically. Now, interestingly, and we can talk about this in class, a whole bunch of cultural significance has been ascribed to hymen anatomy and whether the hymen was completely intact. Historically speaking, and still to this day in some cultures, if a woman does not have what is perceived to be an intact hymen, although this may look like it's not intact, but it actually is, she may not actually be considered for certain positions. For instance, historically in the European monarchy, queens had to have an intact hymen if they weren't married. And sometimes a woman is not considered marriageable in some cultures still if there is not an intact hymen, which would be a good thing for an in-class discussion if you guys would like to discuss it. Okay, and that is it for the female reproductive tract.